Good evening, doctors and all my followers. Today our topic is what is the normal duration of intercourse, or we can say sexual activity, between both partners, male and female. In case, what is premature ejaculation? If a male uh, not able to continue his sexual activity more than 2 minutes, so it is known as premature ejaculation. Why is it so? According to the books, guys, I already saw a lot of videos on YouTube about premature ejaculation and normal intercourse duration, but even doctors, those who are highly qualified psychiatrists, they are providing a false and wrong information on YouTube, as I am sure, because according to the books you have to maintain your intercourse at least 2 minutes. It's a criteria, but not always. I am not saying that always, but it's a duration. 2 minutes minimum you have to perform, or more it's possible. In some porn films, people are performing like half hour or 1 hour or 2 hour, but I don't know how. But there is some medications also available which increases the duration of your intercourse. Yes, nowadays medicines are available, but in some video I found they told no medication, but medications are there. It's possible to prolong the sexual activity or intercourse. And when we say that there is a proper intercourse or there is no premature ejaculation by when the both partners are satisfied, a female partner or male partner, when they both are satisfied with their relationship, that means they are healthy one. Maybe the duration is 10 minutes, 5 minutes, 3 minutes, or 30 minutes or 20 minutes. It's very couples to couple. Frequency also. So if somebody have problem of premature ejaculation, if the male partner is not able to maintain his relation more than 2 minutes from last 1 month or from last 6 months, it is considered as a premature ejaculation. Yes. And erectile dysfunction is another classification or theory. Due to some diseases also there is premature ejaculation, but the most common cause is psychological, stress, anxiety, tension, by which a male is not able to achieve, because he found that last time he is failure and this time also he has a mind prepared already that he is going to be failed. But sometimes it is due to some diseases, need to rule out the cause and need for treatment and consultation. Myself, Dr. Hemant, and I am MD in internal medicine, which I told you here or which I tell you here, the all informations are true and exact. If you are suffering from this kind of problem, you can contact me or you can mail me, and I try to help you. And this is the only point of view of science. There is nothing wrong in such videos. It's just for information for those couples. And I want to say that once a while, every young couple, not every but 90-95% couples are going through this situation, premature ejaculation, and lot of factors like diseases, psychological, sometimes stress, anxiety, such factors, depression, and a lot of things, lot of factors, and so many medicines were also present. And finally I want to say thank you, good day and goodbye. If you like this video, put like on it. If you have any queries, any comments regarding this, you can ask me. Thank you, good day and goodbye. And my channel is just only to spread education and knowledge towards our society. Thank you, good day and goodbye. If you like this video, put like on it. Thank you, namaskar.